Magandang gabi Pilipinas, maayong buntag Cebu or Bisaya. Good morning America. Ito ay si Dr. Raul Inad from Cadenza Medical Clinic in Ave Maria, broadcasting live from Ave Maria. You might have thought, siguro nagtanong ka, ang total cholesterol ay ang ultimate test to prevent heart attack or stroke. Bakit may normal na cholesterol pero nag-atake sila sa puso o nag-atake sa kasing-kasing or they have a heart attack? And the other flip of the coin is that bakit total cholesterol taas sila pero hindi sila nag-heart attack? If you like this video, kung gusto mo tong topic na to, hang on until the last minute of the video. Because we're going to dissect every bit of it, understand. Tutusin natin kung bakit. Ano ba ang laman sa test ng cholesterol? Ito ay total cholesterol, HDL, LDL, sapat ba to? So, makinig ka. Please. Bueno, let's start. Total cholesterol is, ito ang buo ng cholesterol. Imagine, isang bucket ng cholesterol, isang grasa. Dami diyang components sa cholesterol. Number one, pinaka-importante, ang HDL or ang good cholesterol. Ito ang galing sa pag-exercise mo, tataas ang HDL. Kung kakain ka ng mga oily food or good oils of food, for example, tuna, mga isda na oily. Not isda na iprito, no. Isda, klaseng mga isda na high in good oil. For example, salmon, sardinas, tuna, for example. Sa mga prutas, avocado. And all those healthy food na may mataas na olive oil, for example, omega-3, olive oil. Thanks for watching, Zeni. For example, also mga lato. This is the seaweed. Seaweed has a lot of omega-3. So ito ang magpagpataas ng good cholesterol or HDL. So ano bang bahagi ng ano pa ang parte sa total cholesterol? Imagine total cholesterol is a bucket na lahat grasa, oil. So we have talked about HDL or the good cholesterol. Itong HDL, ang function nito ay parang pulis. Mura siyang pulis. Kukunin ang mga bad cholesterol or LDL ang bad cholesterol to dump it to the liver. So yan, the good cholesterol is in fact just the one part of the total cholesterol. Ang iba pa, ang bad cholesterol or LDL, hindi lang simple yan na mag-identify ka ng LDL. May large LDL and the small LDL. Itong small LDL ang mas significant. Together with the triglyceride, ito ang pinaka-bad cholesterol. Bad. Because the triglyceride and the small LDL, papasok siya sa fenestrae, sa lining sa endothelium. Ito ang lining sa artery nyo na nag-supply sa heart or tinatawag na coronary artery. Ito pa ang dahilan sa pag-build up ng plaque sa blood vessels nyo, sa coronary artery, na nag-feed o nag-supply sa blood supply sa heart. So what will happen? Kung marami siyang cholesterol, especially the small LDL and the triglyceride, papasok siya sa fenestrae, mag-build up siya ng plaque. Plaque para siyang very thick plaque. Ito mag-build up ang plaque. Kung ito ang blood vessel niyo, kung plaque dito, it will push the coronary artery until mag-stenosis siya. Liliit ang lumen, ang passageway ng blood vessel nyo sa para pagpasok sa mga blood supply towards the heart. So yan. Pero pwede yang masolbar. Number one, limit the number of source of the total of the bad cholesterol and the triglyceride, the small bad cholesterol. Itong mga maliliit na LDL. Ang LDL, especially the small LDL at triglyceride, galing yan sa asukar, hindi sa asin. Hindi yan sa karne, sa asukar. It is very important, dapat natin intindihin yan, because that will change the kind of food that you want to prioritize eating, especially the way you cook it, because I will explain. I-explain ko yan. So, balikan natin. Ang HDL, dahil sa increased exercise, aerobic exercise, mga oily food, for example, like tuna or salmon or the sardinas and avocado. Yan ang HDL. Kukunin yan ang mga LDL, mga bad cholesterol, i-transfer niya sa liver para ma-recycle siya to another type of cholesterol. So back again, ang bad cholesterol or LDL, sabi nila, not all bad cholesterol that is labeled as bad, ang LDL or low density lipoprotein are bad. The large LDL is buoyant such that hindi siya papasok sa fenestra, hindi siya maging source ng plaque o pag-build up ng plaque sa coronary arteries mo. Ulitin ko, ito mga triglyceride and small LDL or the small bad cholesterol or low density lipoprotein, siya mismo ang dahilan sa pag-build up ng plaque. Ito, pumasok na siya sa artery niyo. Tapos mag-build up siya, mag-constrict ang blood vessel, liliit ang lumen, ang passageway ng blood patungo sa heart. So kung mag-rupture siya dito, paano siya mag-rupture? Kung magagalit ka, kung ang sympathetic tone increased, kung mas stress ka, kung hindi ka matulog na eksakto, o kung mag-infection ka, na infected ka ng virus or an ordinary, what do you call this, infection, mag-pneumonia ka, pwede rin, mag-rupture yan, pwede ka mag-atake. Or you eat something that is very obnoxious. In fact, there are some other some case reports that acute inflammatory event can happen with surge of some food, very inflammatory food. For example, high in sugar, por ejemplo. So these events can happen. Ito ang mangyayari sa iyo pag kakain ka ng asukal madami. Ano ang pagkain sa Pilipinas na pwede ang source dito? The refined carbohydrates. Ang pagkain sa Pilipinas ay marami siyang refined carbohydrates. Intindihin natin. Rice, for example. Bakit ang rice? Bakit ang corn? Bakit ang mais? Because ang rice, galing siya sa grain. Pero sa loob ng grain, por ejemplo, may fibers yan ang nagtakip. So pag-process, paggaling niya, ginaling siya sa, what do you call this, sa rice mill, nakuha ang fiber, ang na-expose, ang refined carbohydrates. The same with mais. Ito ang dahilan na mag-surge ang glucose, ang asukar sa inyong dugo, sa serum, when you eat rice. So is it like a social taboo that you have to avoid rice or to be kind of snooty about rice? Well, the reality is rice is a refined carbohydrates. Like any food, kahit anong pagkain, kung damihan mo yan, overdose yan. So, ang pagkain natin, dapat siguro i-revise, i-modify, na menos ang refined carbohydrates and increase the fiber. For example, the vegetables. Ang dami ang gulay sa Pilipinas. Ang pinakbit, ang kangkong, alugbate. I love that Bicol Express. Marami yan siya. So, if you increase the fiber, malimit mo ang craving sa carbohydrates. So, this will help decrease the ability for you to voraciously eat, or ano ba yan, kung damihan nyo ang pagkain sa refined carbohydrates. So ano pang source ng refined carbohydrates? Ito ang pandesal. Wala yan. Ang pandesal, walang fiber talaga. I-press mo ang pandesal, wala siya. It's parang papel, parang karton. No, karton, parang papel. Very thin, walang fiber, glucose lang ang maani mo. So in most Filipino homes now, we're shifting to cereal in boxes. Kung tutusin mo, i-melt mo yung, what do you call this, the cereal in a box. Matamis siya, sweet. Tapos, ilagay mo yan sa leche or sa liquid, it will melt because there is no fiber. You need the fiber. So, if you want to allocate funds, o kung gusto mo ka magasto ng healthy food, iwayan, what do you call this? Move away from the cereal. Go back to the good breakfast, the Filipino breakfast. Rich in fiber, o mga gulay, o karne, or isda. So yan ang i-focus mo. Do away with the cereal. Yes, huwag kang kakain ng cereal from the box. Pwede naman mag-oatmeal siguro, pero oatmeal na Quaker Oats na talagang i-boil mo para ma-soften siya because that has fiber. Example yan. Pwede naman din ma-change ang configuration sa rice. Ito ang secret. I-boil mo ang rice, tapos i-refrigerate mo overnight. That process of refrigeration, yung process ng refrigeration, ma-change ang configuration ng carbohydrates to a complex carbohydrates na menos siya ng glucose ikumparar sa rice na fresh steam rice. Ito, pwede yan gamitin, pero huwag namang isang mound. Siguro kutsara, 2 kutsara ng rice. At damihin mo ang gulay at karne o other food that we can discuss more. What about pasta? Yan, maraming good Italian restaurants sa Pilipinas. Pero ang pasta is also refined carbohydrates. Si ate, for example, it's good to honor the nurses in the hospitals. They're the big hit kung may potluck sa hospital. So, mga co-nurses niya, sabi, mag-request, dalhin mong pansit, dalhin mong chicken adobo. Wow, that's great. Tapos ang pansit is rice noodles, refined carbohydrates, yan siya. So it would not be a good preferred food to eat every day. Siguro, kukuha ka ng atsara, for example. Sa Florida, we can grow papaya. Pero sa Pilipinas, madami naman papaya. I encourage you to use that. Papaya is rich in papain. Ito ang enzyme na is good for digestion. Tapos kung ma-ferment mo sa vinegar at sugar para maayos ang taste, itong fermented food is favorable for the bacteria, the microbiota. This is more healthy compared to just refined carbohydrates. Damihan nyo ang atsara, menos ang asukar. Damihan ang isda, damihan ang gulay, menos ang rice. Pasta, you can do it for on occasions. pero huwag na magpansit araw-araw. O noodles. The worst is Brahmins. Because ang noodles, ang dami yung preservatives. Those preservatives will destroy the gut, the gut lining, the mucin layer na provoke sa inyo ng isang state na leaky gut. Itong leaky gut concept is very important. Importante siya sa health sa gut, especially also sa lining and also sa microbiota or the good bacteria na kailangan sa overall health, even not just from metabolism, pag-prevent sa diabetes, but also sa mental status ng tao. So, then again, total cholesterol is not the end of the test. Talagang ang particles, ang partikulo. So, kung pupunta ka sa doktor nyo, hihingin ang pag-study ng particles ng cholesterol, the small LDL and the triglyceride and the HDL. Do not be preoccupied with the total cholesterol because a lot of times ito ang rason pag total cholesterol bibigyan ka ng statin drug or medisina para paubos sa cholesterol, para pababa ang cholesterol. Ito ang flaw ng medicine. This is not how to treat or prevent cardiovascular disease. Because the total cholesterol is not the end answer. Ito ang bad cholesterol, and not just the bad cholesterol total or the LDL, it is the particle, the small LDL triglyceride. Pero ito lang, matest mo ito on a special test called NMR or Nuclear Magnetic Resonance Test. Itong mga speed test sa opisina na mag-describe lang ng total cholesterol or a triglyceride, perhaps it's good to change the attitude. We have to at least twice a year take a look at the details of the mga detalye sa test ng cholesterol nyo. Because, take for example, a friend of mine, amigo ko siya, isang doktor. Ang total cholesterol niya was normal, 170. Pero pag test ko ng small LDL, 1,500 small DL. Ang triglyceride niya, above 200. It is good to decrease the triglyceride menos ng 150. Pero I told him, tapos ang waistline niya nag-increase kada buwan. He is white, so his cholesterol, his waistline should be less than 40. He's a man. Pero kung Pilipino ka or Asian or Latino, for example Mexican, ang waistline mo dapat, kung lalaki ka, less than 35. No exception. Kung babae ka, your waistline measuring from the hip bone, make a parallel line, it should be less than 30. Waistline is not just aesthetic. Ito hindi pa papaganda. Liposuction will not solve it. Dieta. And the other thing is this, diet filled with sugar, ito ang mag-provoke ng insulin. Ang insulin naman mag-stimulate pag-increase ng visceral fat. Ito ang fat dito sa Bisaya, puson o sa waistline. Na ito ang dahilan sa inflammation sa katawan nyo. Ang inflammation, pinagsabi, is an increase in interleukin-1, interleukin-6, tumor necrosis factor. Ito ang dahilan sa pag-provoke ng inflammation sa katawan, to include predisposition to cancer. So ang asukar is related to the predisposition for cancer. Let alone, cancer cells magugustuhan niya ang sugar. That's the reason why one of the modalities of treatment sa cancer ngayon ay mag-fasting para ma-increase ang ketones. Sugar is the number one enemy. Siguro naman sa history ng salvation history, what was given to Eve, asukar, fructose, apple. Is God telling us, ang Diyos ba ay nag-hint sa atin, When you fast, do not just fast for food, the total cholesterol. Umpisahan mo pag-fast ng sugar. Sa Pilipinas, ang dami naman. Okay, rice is a staple, pero bawasan, decrease. Ang dami ng sugar sa Pilipinas. Bread, for example. Maybe we should start planting kamote, for example. A sweet potato is rich in fiber. It is a good substitute. Magandang substitute siya sa rice. And increase the production of or consumption of vegetables, gulay. In Florida, I grow my what do you call this? My potatoes in pots, so I can get the what do you call this? The kamote tops, and even the mature leaves is good. You can still use that. Dito sa backyard ko sa Florida, by at least I have 4 malunggay or moringa, because these are good to make the drink, a tea. Instead of buying Coca-Cola, ang ginawa ko dito, I boil the malunggay and I put a little bit of clove para ma-increase ang production ng mucin. Lagyan ko ng kunting honey para taste. And sometimes I put something else, like spices or herbs. Ito dapat ang drink, ang beverages natin whole day. Malunggay and make some tea out of anything, like guava, for example. Do away with soda. Itong Coca-Cola, for example, or mga soda natin, rich in high fructose corn syrup. Especially here sa Amerika, ang ginagamit ng asukar, ang high fructose corn syrup. Very inflammatory, very inflammatory. In Mexico, I think they use sugar cane. In the Philippines, I don't know what they use. I'm not so sure. It tastes different. But the soda in itself is deleterious to your health. Ito pa, fruit juice. Fruit juice is an overdose of fructose. Isang asukar na galing sa fruit. Remember Adam and Eve? Manzana. You think it's healthy. You make a fruit juice or fruit juice from pineapple. Ang problema dyan, may sugar ka pero walang fiber. For example, a glass of juice has probably needing 4 fruit. That's an overdose of fructose in itself. Pero walang laman, walang fiber. Ang fiber, importante sa paggamit sa pag-process ng fermentation sa microbiome dito sa gut natin. Kung walang fiber, ang microbiome kukuha ng mucin layer sa intestine, and that can also be isang dahilan na ang mucin layer ma-eliminated or ma-decrease, tapos wala siyang production ng butyrate, isang short-chain fatty acid na mag-heal sa leaky gut. So ito ay importante. Fiber and iwasan ang sugar, ang refined carbohydrates, which are rice, corn, maize, pasta, pan, and white potato. Mga siguro sa Pilipinas, you're eating also French fries. The consumption of French fries in itself, white potato has no fiber. Tapos, if you cook it in deep heat, that will give you a production of advanced glycated end products or age. Itong age substances maka-provoke ng aging immediately. It will brown your tissue. It will make your blood vessels brown inside. And it can also predispose you to develop cancer, itong age. Especially magsugba ka. We'll talk about lechon later, as long as you can make it really careful na ang meat ng lechon will not become brown. Slow cooking. So I guess the best food there is there that I can think of would be the boiling, steaming, for example, puchero, my favorite. And of course, gulay. Now, we talk about this, taking care of the stress. Because ang stress ay ang pinaka-importante na dahilan sa pag-increase ng sugar. Sugar will increase the triglyceride, increase triglyceride, increase also the small LDL. Pero paano mababa ang epekto ng stress? Meditation. You inhale, 4. You hold. You exhale, 6. Hold, 4. I-repeat mo yan 20 times. 4 times a day. In the morning, noon, tapos may devotion pa. The Chaplet of Divine Mercy. Sabi, pag mag-inhale ka, you can say, Jesus, no, for the sake of his sorrowful passion, hold, 4. Have mercy on us sinners. Hold, 4. I-repeat mo yan every 3 o'clock. Tapos i-repeat mo yan sa ang meditation before you go to bed. Ang epekto nun, ang vagus nerve nyo matone. The vagus nerve will be switched, the sympathetic tone will be switched to parasympathetic tone. So menos ang asukal. So in conclusion, cholesterol testing is not just total cholesterol because may marami pang mga elements sa lipid, triglyceride, small LDL, and the HDL. Ang small LDL and triglyceride, which is ang pinaka-dangerous na particle, mabawasan kapag bawasan nyo ang sugar. Number 1, anything sweet, refined carbohydrates. Number 2, atindihin nyo ang stress. Mag-meditate ka. Meditation is not just to think about prayer. It also has a physiological effect. May process siya sa katawan, sa cerebro, sa brain na mag-change siya sa sympathetic to parasympathetic tone such that ang katawan mo less inflammatory. So then the question is cholesterol testing, total cholesterol, enough? I would say no. Ask your doctor to look for the particles. Second, is the Filipino food inflammatory? Kung kakain ka ng refined carbohydrates, pansit, noodles, rice, fruit salad, mag-coke ka pa, maghalo-halo, mag-ice cream, iyan inflammatory. Pero marami namang mga pagkain sa Pilipino na very healthy. Gulay, Bicol Express, pinakbit. Marami pa dyan. Puchero, isda. Yan. If I go to the Philippines, itong kakainin ko araw-araw. I'm craving to go to the Philippines. My last trip was like 2006, so I have to go back soon. And again, stress. The only ultimate healing for stress is meditation, guided breathing, and to meditate is unconditional love. Ang unconditional love, ang gugma sa Diyos na walang kondisyon, unconditional love para masalbar tayo. Ito ang lifestyle na pwede ma-augment, ma-maintain para menos ang predisposition mo para to develop heart attack and stroke. I'm rehashing my Tagalog, and I'm hoping I can serve you more. This is Medicine and Faith, live from Ave Maria, Florida, from Cadenza Medical Clinic. I'm Dr. Raul Linad, specialist in functional medicine and regenerative medicine, internal medicine, and clinical lipidology. And I'm a practicing Catholic. Thank you very much.